There's not really a test for extension, but there's definitely an active test for extension. Predominantly where most people lack extension, right, or have an inability to extend is, I mainly look at their vastus medialis and what's going on. So I just say, go ahead and straighten the leg for me. And I palpate and I feel like, where is there more activation? David actually gets good activation on his vastus medialis. It's not too bad. People usually have a lot more tonus on their vastus lateralis. That's pretty normal. Go ahead, relax. When we really need to be concerned is obviously if there's pain involved, right? If they're like, hey, I've got pain on the inside of my knee, and we've got really awesome activation in vastus lateralis, and vastus medialis is like sad and flaccid, you're like, maybe this needs some work.
Sad and flaccid.
Yeah.
Sad and flaccid. That's a terrible state.
The other thing to happen, and he didn't do it, but what's pretty common, you'll see there's a theme. You'll ask someone to engage their quad, and this will happen. Their foot will turn out. If you see this happen, that person's very special. I don't know why it happens, but I've seen it happen before. And they'll go like that. It doesn't happen very often. This one's way more common, but this will happen sometimes as well.
Which would tell you guys what they are engaging what for knee extension.
Vastus medialis.
Medialis, yeah.
If they're
Or-
special.
In
If they're
that case,
special.
hip rotators, right?
Yeah, they're
Going into
internal
external, internal rotate. Just like we saw with the foot, a lot of people went to their
Oh,
knee
yeah.
extensors and knee flexors. Same here. A lot of times when you engage knee extension, people will go into their hip, which forces it into rotation. Just as if they're using glute medius to help out, then yeah.
So we bend. The tricky thing about rotation, right? You have to have them dorsiflex. So you're gonna pull the toes up, right? I have my hands, right, like right where the femoral condyles and the tibia meet. So I'm at this little space in the joint line. I usually use the webbing of my hand to feel how the bone will oscillate. And I'm just gonna have you turn your toes in. So turn your toes in. So what I can feel is he is getting a lot of motion through his ankle, but not through here, not through the knee joint, right? And then we're gonna have him turn the toes out. Much better. You can actually, if you're looking, you can see how much rotation he gets. So again, if he's limited, right, in internal rotation, what am I going to treat? Things like biceps femoris, right? The posterior portions of vastus lateralis. Like that's the stuff that I would start to treat. Obviously moving on up into the hip and so on and so forth, because that can be restricting the motion, right? Go ahead, go again. It doesn't move at all. And based off of how little it moves, this might be something where I would do a little bit of like joint opening or tractioning of the joint to help him with that movement, not just soft tissue work, because there's literally like no joint play whatsoever. Right? Go ahead, go roll onto your belly. And yes, it's this simple. Let me see you pull your heel up towards your butt. And I'll use butt with clients. I won't say glute because they might not know what glute is. It can be as simple as that. Right? If you want to get really specific and you want them to engage different hamstrings, so we know that the vastus, not vastus, the biceps femoris was quote unquote